Okay, we're back on. We're live again.
Thanks, Lynn. Thanks, Ian.
Thank you. Councillor Jenkins.
Yeah, thanks for that. What I wanted to ask about really, or wanted to make the point about, is I do have some sympathy with Councillor Ver in relation to whose fault it is the timing is as it is. So I wonder if there's another way we can say it, which is actually the implications of the timing on this committee and on the council, who are still dealing with some, COVID issues and coming into an election, which actually makes it very difficult, as we're finding, for us to, really scrutinise what's coming out of the white paper and what's going to be coming out in the next stage as well. So I wonder whether Jane could alter the wording slightly to reflect that.
I'll have a go.
Thank you. And completely, as Councillor Biscoe has said, some of the issues that are around being bounced into something that isn't going to work. Always, take into account the the border issues. The other issue is we need to not forget Scilly and Cornwall, Cornwall and Scilly. We need to be talking about as well, because there's no way that Scilly can operate as an ICS on its own, and I think we've been working very well together so far. I'm not quite so worried about the border issues, because a lot of ICSs will have border issues, and more borders than we have. We only have one border with Devon. If you're in the middle of England, then you've got ICSs all around you with several borders. So there are going to be ways of dealing with other areas that can be looked at. I do, though, agree with Councillor Biscoe that we need to be looking at more facilities available within Cornwall for some of those hospital services that shouldn't need to be done at Derriford to be able to be available within the North and East Cornwall area. So that's really by way of waffling a bit while Jane rewrites the recommendation, I think.
There is one more speaker to come, Loveday, if you want to back out at the moment. Councillor Nichols. Sue, please.
Thank you, Chair. Yeah, I mean, I think it needs to be quite a strong recommendation. I think I didn't get all what Jane was saying because it sounded a bit airy in places. I think we need to have strong recommendations in terms of what we would like to see. Whether we get it is another thing, but what we would like to see as an integrated care service in Cornwall and iOS. So I'm not sure, Jane, you'd have to share those words so that we can make that a bit stronger.
Okay, I'm trying to type them in the chat. Right, I'm doing it now. Okay, if I read out what I've got then very quickly. This white paper comes at a very difficult time when the system is still in the midst of dealing with a pandemic. Is that non-political enough? The new Scrutiny Committee should focus on the potential structural arrangements for the ICS, take evidence from all parties involved, and produce a view. Or is that not strong enough, Sue?
It's just about ensuring, it's like I was saying to Carolyn just now, that you have clinical leads, but there doesn't seem to be any parity across it in terms of social care leads. So, I would like to see in the PCNs even that there is an equal parity between a medical director lead and a social care lead. I think that's what it's about. It's about ensuring, if you look at Klein's stuff on politics in the NHS, there's always been that kind of like tension. But I do think if we're going to have integrated care services, then there should be that integration and joint leads across all of it.
Can you come up with a formal words, please, Jane? And Leanne, have you noted down what's been said? I can't find it on my chat. That's the thing at the moment.
Okay.
Okay. Councillor Bird, did you want to come back in?
Yeah, I can't support any comment about the timing because we haven't debated that. We haven't heard any evidence of that. It can be quite easy to see a flip side to the timing, that actually the learning from the response to the pandemic is that there's a prescient need to have rapid integration to deliver excellent care. But we haven't heard any evidence either side of that. So if people want to persist with comments about timing, then I think that should be a separately voted on, because I can't support it. Sorry.
Okay, thank you, Councillor Barr. Councillor Nicholas, do you want to come back in?
Yeah, I just think, I mean, I don't mind whether you put in about the timing or whatever. New HASCOSC around the potential structural arrangement of the ICS. I think as long as we've got that parity, I'm not sure that says that. It says democratically accountable, but I do think if we're looking at integrated budgets and all the rest of it, then we should have that parity about how those budgets are spent.
Okay. Leanne, over to you. The recommendations in there, the first one was to thank Miss Andrews for her presentation to the committee, and then the second and second one should be the one that Jane's just put in.
Okay.
John
So
Pollard, hang on a minute before Leanne. Councillor Pollard, you've just indicated.
Just two things. The first is, I think we should say this is certainly a disappointing timing for this committee, isn't it? Because we can't follow up and we haven't got the capacity to make decisions at this late stage. So, you know, it's not politically motivated, but there is a disappointment for me in the way that's come up. And I've just seen Loveday's operate as a true partnership, and I think that covers very well what Sue is saying, because again, we can't tell the next committee what their line should be, but we can point them in the direction of the areas they should look at. And I think taking Sue's point entirely, then I think that phrase works for me.
Okay, thank you. Leanne, over to you.
Could that go on the bottom of my recommendation, fully democratically accountable and operate as a true partnership?
Yeah, very good.
Okay. Leanne, have you got that?
So I've got three that are on the table, which are proposed by Jane Kirkham. Do I have a seconder, please?
Are you happy with what there is there, Leanne? Because there's another bit at the bottom that I've written about. We believe any ICS should cover the people of Cornwall. And I was trying to say, I said, and not be extended further into the southwest region, but I'm not quite sure exactly how to phrase that.
Okay.
To cover what we were discussing about it covering the people of Cornwall.
In terms of the timing, so at the moment I've got the first recommendation is that the white paper comes at a very difficult time when the system is still in the midst of dealing with the pandemic. Now, there was a discussion about whether or not that's actually expressing disappointment with the timing of the white paper for the committee, because if the committee was continuing, then actually it could prioritise that work to undertake it. So is that staying as it is?
We could add
I just wanted to double check because we've had two views expressed. So
we could add at the tail end of this committee, couldn't we? And then we could take it as a separate point, so those who don't want to vote for it can sort of vote on that separately, if whether they want to take that out of the recommendation or not.
Okay. So that would read that the committee expresses disappointment that this white paper comes at a difficult time when the system is still in the midst of dealing with the pandemic and at the end of the local authority triennial. Is that okay?
Yeah.
Okay, so the second one, and what I will put that as a separate one. The second one I've got is that the new health and adult social care opening scrutiny should focus on the potential structural arrangements for the ICS, take evidence from all parties involved and produce a view. It is difficult to integrate 3 separately managed and funded systems, and the new bodies must be fully democratically accountable and operate as a true partnership. Is that what you're proposing?
Yes.
Yes.
Happy to
Okay.
Sorry, I'm trying to
second.
read something else and think at the same time.
Happy to second.
Have we got item
Can
3
we-
in there as well?
We've got
Sorry.
item 3 and item 4. So
And
one.
Sorry, Leanne, just to jump in again, when I've said take evidence from all the parties involved, could we maybe put including the public in there as well?
Okay.
Involved in the potential new integrated care system before determining the way forward for Cornwall, maybe.
Okay, now I'm lost. So the new, bearing in mind that actually we are recommending this to a new committee who can decide what
Yeah.
they want to do, it's their work programme, and that the white paper impacts on the scrutiny committee anyway. So the new health
The
and
new
adult
social care.
social care committee should focus on the potential structural arrangements for the ICS.
Yeah,
Take evidence from all parties involved, including the public, and
Public.
produce a view.
yeah, and produce a view on the way forward, the new integrated care system for Cornwall or something like that. Yeah.
It's
You're
very
saying
difficult.
integrated care system twice there, Jane.
So-
No, I don't
Take
think
that
that.
last bit out.
Yeah,
And
so on the way forward for Cornwall in the Isles of Scilly is what I put.
Yeah, that's fine. And then the last one, slightly reworded.
We
Um,
okay.
Number 3, maybe insist that any new system must be for Cornwall and the Isles of Scilly with continuation of the existing well-established arrangements for cross-border support. Something like that.
You can all hear me desperately trying to.
Want to make the point it should be Cornwall, but obviously the relationship with Derriford, etc. is important.
Okay, so we believe that we insist that any new system should be for Cornwall and the Isles of Scilly and continue the existing cross-border relationships.
Yes.
Okay, and then the final one is to thank
Yes,
the officers for their
is what Armand said.
right, and 2 to 4 are being taken as one section with
Yeah, if the number 1 being taken separately, if there's
and
if
number
it's
1 be
professional.
taken separately.
Yeah.
Okay,
Go to
Jane,
the
you
vote.
were the proposer.
I'm happy to second, Leanne.
Okay. Right. So Chairman, are you happy for me to move to the vote? And I will vote on number 1 first. So I'll read that out to you.
Yeah, fine.
That is, she says, desperately losing a minute. I think a minute taker to do. The white paper, who are we recommending this to? Because if not, it's just a comment.
I think this has got to be to the new committee.
So, but the white paper comes at a difficult time, wouldn't be to the new committee.
Good point.
So is this to government? Is this to?
I
Why
think,
not send it to the ICS itself?
Armand, can I come in? John Pollis. I think it's very difficult to separate it because it's a comment
Yeah.
to enhance our proposals, isn't it? And therefore it's very difficult to hide it off.
Yeah.
You know, I think it is just a statement, isn't it, as far as we're concerned?
Yeah.
And you know, in sympathy with the officers, this is a difficult time to look at this.
It would be a shame to lose the recommendation though, because this comment was controversial. That was why I was talking about hiving it off.
No, I understand that, but I understand that entirely. But
Chairman Councillor Ver has expressed the wish to make a comment.
Yeah, Councillor Barr.
It's a shame to be ending this this committee 4 years of disagreement, but just to challenge what Councillor Pollard said, I'm not sure the fact that we vote on recommendations separately is irrelevant. We vote on the strength of the recommendations either collectively or individually, and they should stand up on their own. And I don't think this stands up on its own. We don't even know who to send it to, so I think it's falling apart all around us. But I still would recommend that we if there's disagreement, that we have to exercise our democratic right, folks.
I'm sorry, Andy, that wasn't my sentiment or my statement. My statement was exactly as you've just said, because we don't know who we're recommending this to. It's in my view, it's a sort of comment on the discussion we've had. So, you know, I don't want to say, I want us all to vote for it, frankly. But if you can't, then we need to separate it. Then we need to establish who's the statement for. And I think it needs to be just a statement, doesn't it?
Chairman, could it be resolved by including it in the minute, so that as part of the discussion the statement was made, and include it in the minute rather than as a recommendation?
Are you happy with that, Councillor Kirkham?
Yeah.
Okay.
Shall we take the other
So if
as a job lot?
If that comes out as a statement within the minutes, that statement was made, and then it will be there on paper and on the live stream on YouTube if anybody wanted to look at it. So we're removing number 1. Jane, are you happy with that? Councillor Kirkham, apologies. Councillor Jenkin, are you happy with that?
Yes, so long as it's
I will
clear
capture,
in the minutes.
yeah, I will capture it as a specific statement in the minute.
That a number of members felt.
Yeah, absolutely.
Yeah. Before we go to the vote, Councillor Nichols wanted to come in.
No, it was really just to say that it is a statement, because that's the situation that is around at this minute in time, isn't it? So, yeah, I'm fine for it to go to the minute.
Yeah, go to the vote, please, Diane, on the other items.
Okay, thank you. So I'll call you in order, and if you can tell me if you're voting in favour, against and abstaining. It is the 3 recommendations I've read out earlier that doesn't include reference to the time frame. Councillor Biscoe.
He's gone.
He had to leave, isn't he? Councillor Chopak.
4.
Councillor Ellenbrook.
4.
Councillor Gammon.
4.
Councillor Jenkin.
4, sorry.
Councillor Kirkham.
4.
Councillor Lennox Boyd.
4.
Martin.
4.
Councillor Nicholas.
4.
Councillor Parsons.
4.
Councillor Pollard.
4.
Councillor Toms.
4.
Councillor Ver.
4.
Councillor Williams. Left the meeting.
Okay.
Of the members eligible to vote, we have 12 in favour, with 3 people not in the room.
Okay, Leanne, we need to take a short break.
Desperately do. I need a cup of tea.
Yeah. Shall we say quarter of an hour and get back, and then there's only 2 very short items to go, I know, but you know, we've been sat here now nearly for 4 hours and a bit, so just have a quick break, cup of tea, and come back. How long? 1:30, 1:45, 22, something like that.
Members, if you're happy with sort of coming back at 20 minutes be enough?
Yeah, that's fine.
Okay, so at 20 to 3. I note that Councillor Butcherworth had to leave the meeting, so his updates will be, questions will have to be sent to him. So So 20 to 3, if people can turn off their microphones and they can turn off their videos, please.
Thank you, Chair. I'll now leave.
Okay, thank you. See you all in about 20 minutes. Thank you.
Armin, can you hear me?
Yes, can David.
Okay. I would wanted to ask Rob a question, but he's gone. And I really wanted to ask it in public.
Yeah, you can ask it, and then you know, it can be sent on to him to reply. Is that okay with you, David?
That's absolutely fine. I just wanted to get it in the public arena. What's going on? Okay, thanks, Armin.
Yeah, no problem. I fully understand. It'll
Okay,
probably
thank
be
you.
a cross-border issue anyway.
Undoubtedly, it will.
You could say you're wanting a written answer, maybe.
Yeah. Okay.
Councillor,
Thank
we
you.
are still on live stream, if that.
Okay.
Oh, yeah.
Okay, I'm gonna go and make a cup of tea. Good afternoon, everybody. Are we all back in our seats, ready to go for the last couple of items?
Yeah.
Yeah. Okay. Thanks, Sheila. Okay. Thank you, Andy.
Chairman, Councillor Watchworth had to leave the meeting, and therefore he is unable to take cabinet member questions. Should there be any questions for him, they can be asked. I can note them, and then I can send out the response to the committee when I have it in writing.
Yeah, I think there is one, at least one member that wishes to ask the question. That's Councillor Parsons. David?
Okay, that's fine.
That's correct, Chair.
Okay, David.
Thanks, Chair. And apologies, I've got to leave at 3 o'clock for some safeguarding training from school.
Okay, thank you, Con. Councillor Parsons.
Sorry, caught me by surprise there a bit. This is a question about the overnight provision at Stratton Hospital, on which this committee have listened to me talking many times. The contract for it runs out in April, and knowing this was coming up, I'd spoken to the commissioners and the providers and received assurances that it was going to continue, although there was some nervousness in the community. A week ago on Monday, we held a meeting of all the parishes on both sides of the border that look towards that MIU and overnight services, and attending were David Wilson from CPFT and Mark Wilcott from the 111 service to talk us through it, because it hasn't been working very well for very understandable reasons, and nobody was being critical. We were just trying to understand what the issues have been and how they were going to be resolved. Having received all those assurances, I was absolutely astonished when, although the 111 service were very happy to continue it, CPFT seemed reluctant to give any commitment to continue it at all. So following that, I went to the CPFT. Scott Mann, our MP, went to the CPFT. Rob went to the CPFT, and we all were told that the service was going to continue. It wasn't going to be discontinued. So we asked for a statement which we could then give to the neighbourhood panel meeting this week, just to clear up any misunderstandings that there had been. And the statement we got was this: Cornwall Partnership NHS Foundation Trust is currently reviewing the provision of overnight services at Stratton Hospital with local people and stakeholders. The findings of the review are due to be presented to the Trust Performance, Finance and Investments Committee in late March. If required, the committee will then make formal recommendations to the Trust Board in early April 2021. While this process is ongoing, the Trust will not make any changes to the current overnight provision at Stratton Community Hospital. Well, the first problem we have is that there's been no attempt to consult with local people whatsoever, and we wouldn't have even known there was a review going on if we hadn't held that meeting. If the board are presenting to various committees of the Trust who will make recommendations, then there's a clear threat to shut the thing down in April. And I really wanted to ask Rob what on earth we can do in the light of all these assurances that were given in private, and yet when the Trust comes out with a statement like that. So it was a plea for advice, and also to draw the attention of the committee to the issue, because I suspect this is going to be an ongoing battle after the formation of the new council. Thank you, Chair.
Thank you, Councillor Parsons. I'm sure Leanne will be able to get that answer for you from Rob and from the Trust. Rob is actually a member of the Trust Board, or he attends the Trust Board meeting, should I say. So he should be able to get a reply to you pretty quickly. Okay, have
Thank
you
you.
noted it all, Leanne?
Pardon, Chairman?
Have you noted all the concerns?
yeah.
Okay, thank you very much.
I'll pass that on to Councillor Rochell after the meeting.
Yeah. Are there
Thank
any
you.
more questions for Councillor Rochell?
Yes, Chair, I did put a cross in the box.
Oh, sorry, I missed that. Councillor Jenkins.
Yeah, I mean, really, it's more of a comment than a question in that he's not here. So, but he did make the comment that timing might have, if we'd had a different time to actually quiz the portfolio holders, it might have been easier for him. I mean, I know we did discuss this before, and one of the views was that portfolio holders should be there for the whole meeting anyway, because it reflects what they're doing. But it might be useful if there is another urgent meeting that we can timetable it so that we can actually quiz portfolio holders in person, because I do think that it's very good to have a report from Councillor Rochell about what he's doing, but it's just bullet points. So to try and actually understand what's behind that is quite difficult. So he's just highlighted what he's done, but not what the key issues are coming out of it. And it would be nice to ask him to highlight if there's any key issues that he felt he needed to raise with the committee, rather than just a list of what he's done. I don't know if you can put that into a question for him, Leanne.
I could structure it in a manner that the committee would like to know what key issues he had to inform them of, and if he had any additional information to the bullet points he provided.
Yeah.
Okay, thank you. Councillor Pollard.
Thank you, Armin. I was just going to pick up on that by saying that the easiest way for that, because whenever we schedule it, it may not be desperately convenient for either of the portfolio holders, and it would be nice to have them here all the time, but their time is precious. If Rob had said that at the beginning of the meeting, that he had to go at 1 or whatever time it was, then you could have slotted him in, couldn't you? So I think that's the best way to handle it, in that sort of ad hoc, informal way. The question I was going to ask Rob was if he had any reaction to where we're at with the saga of the Edward Hayne Hospital in St Ives, because this has been a constant agenda item for us for the last 4 years, and as far as I can see, nothing has been resolved.
Okay, thank you. Thank you, John. I'm sure Leanne will pass on that and get a reply from Rob. No other questions I've seen. Councillor Ellenborough, Barbara, please.
Yes, thank you. I hope this is a question for Rob. I've been asked, or it was mentioned to me, I will say, at the PCN that I'm a lay member of, that there was a concern by, certainly by the GPs, that the lines of communication with them from the hospital, if they were discharging patients, and particularly if they were discharging patients who needed care packages, wasn't always as good as it should be. I mean, I'm aware that this is something that's being worked on, but I felt it was important. I sit on this PCN as a lay member, as I say, and that's one of the comments the doctors made to me, that the communication lines weren't always as good as they could be, and it's quite difficult for them if somebody is discharged back to home with a care package and they are unaware of either the fact that they've been discharged or the fact that they've got a care package. As I say, I don't know whether it's something that happens all over the place or it's just a one-off, but that's it.
I'm sure Leanne will help you out with that, with formulating something to Rob over that matter. Anybody else that needs to ask the question? No, okay, we'll go to the portfolio holder for children's, Sally Hawkin. Any questions, please?
And public health, Armand.
Yes, and public health. Yes, a very important part at this stage of the game, especially with what's gone on the last 12 months. Right, Councillor Jenkin and then Councillor Annenbuck. Councillor Jenkin.
Yeah, thank you, Armand. Really great to have a comprehensive sort of reflection on what's been achieved, and really like to thank you for all the hard work that has been put in public health, and all the, you know, it's not been an easy year to do things, but you know, the ability to keep other things going and actually to improve some of the online delivery of things during a pandemic, I think has been exemplary. So, you know, I'd like to thank you very much for that. I just wondered if you had any reflection on the reorganisation at government level with Public Health England and how that might impact on both funding and activity within public health within Cornwall in the future.
Yeah, so I've seen that the Association of Directors of Public Health have asked some questions and expressed some concerns about that. But no, I wouldn't be able to give you a full answer on exactly what the impacts might be. It's a bit like a lot of the other things that we've talked about today, isn't it? That it's we need to see the detail of that.
So you haven't seen the whites of their eyes yet?
Yeah, I think that, you know, one of the concerns is to make sure that the other aspects of public health don't get lost. That because we've been through everything we've been through the last year, that everybody thinks everything's about infection control, which we didn't really talk about. This committee's never really talked about it that I can remember. We don't want to go too much the other way, do we? And spend all the time focused on infection control and forget about those other important aspects.
Yeah, I think the importance of local delivery and delivery that suits the area is a message that could usefully go back from Cornwall.
Absolutely.
Okay. Councillor Allenbuck, Barbara, please.
Yeah, thank you. Just to say, Sally, that the COVID updates that you started to give us a little while ago have been incredibly helpful and really, really useful. And hindsight is always a wonderful thing, is it not? But I do think that should we ever get into a similar sort of situation again, God forbid that we do, that one of the lessons we could learn is that keeping us as members up to date on everything helps us to actually be better people within our community. So thanks, because you know, you always sit there and think, oh yes, somebody's just popped a presentation together, and I'm darn sure that it took an awful lot of work from people who were working very hard. So thanks very much for that. It was extremely useful. That's all I had to say.
Thank you, Councillor. And I think it's we had some challenges, didn't we? Early on, we had some challenges in terms of information that we were able to release, and that made things very difficult as well, because it's hard when you hear that the information might be sitting somewhere in the council, but you're not allowed to access it. So it does feel like we've got to a more comfortable place, and it has actually been really useful to involve local members who are able to feed back on situations on the ground too. I think I'm going to be cut off soon. I'm tired of looking at the clock, Armand. I was going to say I didn't know whether the committee had seen there is a place online where you can look at the vaccination data by local authority now, and that the county I can't speak. The county networks have done some analysis of that, and I thought that would be useful to share with the committee, in that if you look at the England average and the CCN average, then actually Cornwall is doing significantly better than both of those. So I've put the link in the sidebar, but I'll make sure that you've got visibility of that analysis from the CCN as well, because I think that's county council network. That's why the words I was struggling with. I think that's useful for being able to understand that whilst there might be all sorts of individual tensions around vaccinations that people have referred to earlier, the overall picture is that we're doing extremely well compared to others.
The numbers are very high. You know, the averages are a lot higher than in other areas. So yes, thanks. Just a quick one from me. I don't know whose idea it was for the Facebook lives, but I've watched a few now, you know, and I just pop in and watch what's going on, and I think they've been very good. And you know, whoever thought of that idea, I thought it was very good. It's, you know, people come and ask questions, and they're not all zany questions. You know, there's some really good, hard, you know, hitting questions for you know, from members of the public, which I think is a great engagement for the public. You can take that back and pass that around to whoever thought of that idea.
Thank you. That's really helpful. I think we found that we were doing the media briefings weekly, and sometimes felt that the key issues that we thought we were going into those media briefings weren't necessarily picked up by the press in the same way. And at that point, in frustration, we were thinking, well, actually, we'll talk to the people of Cornwall directly. But it also obviously has that very key part of being the people of Cornwall able to ask their questions back of us. And you know, it's really, really useful to see the sorts of things that people have on their mind.
I think they've gone very well. Thank you.
Thank you.
And thank you to your team. Right, thank you very much. Councillor Martin, you've got about 3 minutes at the maximum.
Yeah, so thank you. So that not a question to Councillor Hawkin. Thank you very much for that. I think your section is finished now. This is just now moving on to my Vice Chair's report. Yeah, thank you to everybody who's been involved in the committee for the last 4 years. Thank you for putting up with me as your Vice Chair, and for experimenting with some different ways of doing things. A couple of meetings that I've been to recently, the Keep Our NHS Public is a group that both Councillor Kirkham and I regularly attend, and it was suggested there, one of the members there is on the Citizens Advisory Panel, and they said, why don't any councillors ever come along to the Citizens Advisory Panel, which is made up of members of the public who are representing their GP surgeries and various different stakeholders. So I said, well, we've never been invited. So they invited me to one last week, and I went along. They had a presentation about advocacy and the advocacy service. That was fascinating. And they've said that in future they will pass on the details of their meetings to the Democratic Services Officer. So whoever's on this committee after May will regularly get invited to attend those meetings if they want to. And I would just encourage you to look at what's on the agenda and go and take part. And they were yeah, they were very interesting meetings. So yeah, I think that's enough from me, and we'll see you all later. And now apologies that I'm leaving early.
Thank you, Colin. Just a very small report from me this time. We're due to have 2 briefings in the near future, one about the new development for the children's families and cancer units at Trelisk, and the other is about the A&E department at Derriford, you know, this new development. I think, I'm sure that Deanne has said that it's going to be on the 22nd of March, Deanne?
We're still finalising the dates with the NHS trusts, so it'll be one time period that covers both capital builds as a development briefing for the committee.
Yeah, and I'm sure you would all be very interested in, you know, what's actually happening. So that's one thing. I had a report sent to me from the Southwest Improvement Board about Southwest Oral Health Needs Assessment Dental Reform Programme. I will send it out to everybody, but it highlights a couple of things that you know we've spoken about, and I've spoken about, that the issue of cancer, oral cancer, is more prevalent in Cornwall. You'll read that in the report, and they make some key oral health priorities for each STP area. And for Cornwall, the need to increase the NHS dentistry is a critical issue for Cornwall, especially in rural areas. There is a need for additional support of dental care services in line with the increasing numbers of older people in the area. There is a need to support the recruitment and retention of dentists working in NHS dentistry. There is evidence that there are difficulties experienced by dentists in meeting the contractual targets. And the last one is for parts of Cornwall, there is difficulty for patients to access key secondary care services, particularly those living in the western extremities. So when you get this report, I haven't read it all myself yet. I've just glanced through some of it, and I think that would be essential reading for anybody or anybody that's thinking of standing at the next time. The last thing is, and I put this in my report, and I asked those that are perhaps leaving the council to think of 3 things that they think that the new committee should look at. I think that we should all do that. I will certainly be sending Deanne my views of 3 things that the new committee should look at. They will only be, you know, not a recommendation. It will just be something that we pass over to whoever's on that new committee to say, these are the things, you know, that the past committee would like you to keep your eye on. I mean, with Councillor Parsons, it'll obviously be Stretton Hospital, that cross-border work, you know. With Councillor Ellenbrook, it will probably be that connection with the third sector, and, you know, those boards that are essential to keep that connection with the council, you know, the disability boards and the carers boards and things like that, you know. And I just feel that if we pass on those things, it is up for them to the new committee to take on. But that's, you know, important for me that they get some idea of where there might be things that we need to deal with. They may need to deal with. But for me, it's thank you to you all. You know, I put it in my report that you know, we might have had our differences and all the rest of it, but everybody that's been on this committee, I can see from what they've said and what they've done has been had their heart in, you know, fighting for the best services for Cornwall. And I'd like to thank you, and that's it. I have no business, and I hope you all have a nice rest before you go out campaigning or go into retirement or go on holiday or whatever you're going to do. But thank you very much.
Thank you, Armand. Best wishes, boy. Thanks.
Okay.
Thank you.
Thank you.
I recognise
Okay, bye.
not be popular.